So pregnancy can become high risk or a complicated pregnancy because of many reasons. The number one reason is the mother, and number second reason could be the baby. And if we come to what in mother can cause pregnancy to be high risk or medically complicated, we again can divide it into the condition that mom had before pregnancy and the condition that develops during pregnancy. So, for example, the condition that mom had before pregnancy could be a mom could have diabetes before she got pregnant, or she could have high blood pressure before she got pregnant, or she could have thyroid issue before she got pregnant. And once she get pregnant, these issues can become more complex and they need a different management. So this is one reason why the pregnancy could be complicated. Other could be that a mother is perfectly healthy mother before she got pregnant, but then she develops complications that are specific to pregnancy. For example, mother was not diabetic before, but during pregnancy, she develops diabetes. Or mother did not have high blood pressure before, but she develops high blood pressure during pregnancy. So the reason the pregnancy can be complicated because of mother is because mother may have pre-existing medical problems, or mother could develop new medical problems during pregnancy. That is because of the mother, the pregnancy can become high risk. But sometimes the baby can cause also a pregnancy to become high risk. That may not be medically complex, but it could still be high risk. For example, if mother have twin pregnancies, if the baby is very big or growing very fast, or if the baby is very small or not growing enough. So these are few things that can make a pregnancy a complicated pregnancy. Some part of the complications can be prevented, not all, but it is very important that in the beginning of the pregnancy, or if you have any medical problem, even before pregnancy, we identify what complications can happen and we put plan in place that could either reduce the risk of complication, or if you're lucky, can prevent them happening altogether. For example, if you had diabetes before you get pregnant or very soon from your pregnancy, we can modify your diet to reduce the complications. If a woman had high blood pressure, we can give her some medicines so that her blood pressure remains well controlled. So to answer that question, not all the complicated pregnancy can be prevented, but most of the complicated pregnancies can be managed and well controlled. When a woman has a medically complicated pregnancy, the things we need to monitor is number one, pregnancy, number two, mother's medical condition, and number three, baby. So, for example, if a mother had high blood pressure, so we need to make sure that mom is healthy in other part of pregnancy aspect, but also that her blood pressure is well controlled throughout the pregnancy. And that may mean that we need to monitor her blood pressure extra. We need to change her medication, or we need to add more medications. And then we also need to monitor the baby. That means the mother might need some extra scans, or a mother might need some extra heart monitoring for the baby. So the complicated pregnancies need to be monitored in view of the pregnancy itself, in view of the medical condition that mom is dealing, and also the baby. So it is the whole partnership with the woman and even her family and an obstetrician and midwife to make sure that the condition remains stable throughout the pregnancy. And if it is getting worse, then we identify as soon as possible. So for that, I would say, first of all, mom should try and enjoy her pregnancy. This is the time that is for mom to be relaxed, to be happy. So I think the most important thing is to be happy and to enjoy the pregnancy rather than worrying too much. I know it is easier said than done. There's the precautions that mom needs to take specific to their medical condition will depend upon her medical condition. So for example, for higher blood pressure, she would need to be very specific and very compliant to taking her medicine. For diabetes, she might need to add extra walks in her routine. There may be some dietary changes that need to be done. So in general, not huge. What we advise women is what is easily adapted in their lifestyle. And we should not forget that there's a woman who's pregnant. We're not just treating the medical condition, we are looking after a pregnant woman with a medical condition. So we need to make sure that women feel relaxed in amidst this complicated pregnancy. So the first thing is that mom should again enjoy the birth of the baby, of the healthy baby and her health itself, but not to forget that if mother had a medical condition, it needs treating or it needs controlling. During pregnancy, when the mother gets pregnant, the mother who has medical condition gets pregnant, her medication changes. Sometimes we reduce the dose, sometimes we change the medication. So after the delivery, a lot of restrictions are removed because woman is not pregnant, so they can be moved to the more potent drugs. So they need to go to the specialist or they need to liaise with the specialist who was looking after their medical condition so that their medical condition is appropriately controlled. And for the baby, it will depend. If the baby is small, the baby grows very quickly when they're delivered. So just maybe weight checking. And the mother who have diabetes, their babies it at high risk of having low blood sugar. So we need to monitor the extra blood sugars. So sometimes it is very specific to the condition, the little bit extra monitoring that baby needs. But mother needs to, but we must not forget mother and her condition and involve the appropriate specialist who can look after from after delivery.